Hi, I'm Kelly, back with North Shore Eye Care, and I'm sitting with Dr. Martin right now. He's going to talk to us a little bit about LASIK. People also are always asking about is anesthesia available, or what do we do to prepare them for the procedure?
Right. So,
So,
so people think that, oh my God, it's my eyes. When I lay down, I'm going to
mhm,
be in horrible pain. How am I possibly going to get through this? So, what we do is we give every patient a little something to relax. Xanax.
mhm,
It's sort of like a Valium type substance to relax. And then we numb up your eyes with eye drops. So there's no need for needles or injections, and that keeps your eyes numb, so that the procedure that we do doesn't hurt. We have other options that are for people that are very fearful. So we have a board certified anesthesiologist who is available should we really need to go that route, but that's rare.
mhm.
Um, we can usually keep people very comfortable with a little bit of sedation, numbing eye drops, and just talking to them. The main thing, I think some people feel like they'll be cut off from us during the surgery, and if they're uncomfortable, we won't know about it. But with this type of surgery, as you know,
Right.
we're right there, we're talking, and we get everybody through it. So uh, it takes a long time to get comfortable with people, and have that kind of relationship where your patients trust you that way. And we're thrilled that we have that
Right.
reputation.
Um, Patients always ask about risk and need for enhancement. So, um, what about risks involved?
Great. So at North Shore Eye Care, we have a lifetime commitment on the procedure, and that's unique to us. And there are others, but that's something that we've always had. And our lifetime commitment means that if someone's a -10 and they end up a -1, or there's always a chance you could need a touch-up. In this practice, it's low. It's in the single digits as far as our enhancement rate goes. But we have a lifetime commitment on the procedure. So if you need an enhancement, it's free,
Mhm.
always, forever. And there's no contingencies. You don't have to see us every year. If you have LASIK with us and an enhancement's necessary, it's free. And we do that. That's the way we stand by our procedure, and our patients really appreciate that. Risks in LASIK, the only thing I really worry about in LASIK is infection, because
Mhm.
that's something we really can't control. Some people just get infections, regardless of the best sterile technique. Now, in 17 years of doing LASIK, I've never seen a single infection during surgery or after surgery, which is pretty amazing and lucky. So, no, regardless of who you are and how great your sterile technique is, and our LASIK center is state of the art as far as the humidity, temperature, sterility. It's amazing. It's a dedicated center. There's nothing else going on there. But infections can happen, and that does scare me, especially with some of the bugs that are out these days. But as far as the risks that used to be there with the old metal flap makers, like flap buttonholes and torn flaps and all that, that's virtually been erased by intralaser, femtosecond laser flaps. So the biggest thing in LASIK, two areas of risk were in the flap. If the flap wasn't perfect, you couldn't
Mhm.
continue, and the laser really handled that. So I haven't seen a flap problem in years, probably 10 years. And then the other thing was that the original laser vision correction procedure wasn't that sophisticated. So your visual system has levels of blur. There's near and farsightedness, which is the first level of blur. Astigmatism is the second. And then there's other things like spherical aberration, coma, triple. This is all physics and optics, very
Right.
boring. But the original procedures didn't address it. So there was more night vision concerns, more glare and halos at night. Also, the original metal flaps were thicker and they took up more of the cornea. So
Mhm.
the sensation on the surface of the eye, dryness was more of an issue. So now that we have laser flaps that are more consistent on a regular basis, as well as a thinner and a smaller flap that causes less dry eye, and then an ablation that's customized, automatic centering, automatic tracking, and follows iris registration, most of the risk has been averted. And that's why when you look in the press these days and you look around, um, you don't see much in the way of risk being talked about in the
Right.
press or on the internet. It's really a much better procedure than it was 12 years ago or 15 years ago.
What about patient, I don't even know what the best way to put it would be, like a self-inflicted injury after LASIK if they accidentally touch their eye, maybe using their drops or something. It's just a simple fix,
It's a
right?
great question. If you're going to move a flap, the way the flap settles back down is the suction of the innermost part of the eye it's called the endothelium, and it's like a vacuum. So it sucks the flap back into place. And it's really great that we can use the physiologic workings of the eye to make an eye heal like that. It's amazing. But in the first 24 hours, we put clear shields over your eyes so you don't inadvertently rub. So you can move a flap if you rub it. Again, since we've had laser flaps, they stick much better. It's more like Velcro because it's not so smooth of a cut. So we rarely see slipped flaps. But if they slip, we would put them back the very next day. After the first day, a slipped flap is extremely rare. So you can rub your eyes, put on your makeup, take off your makeup, anything you want, and you should be fine.
Right. So it also helps that we follow the patient so closely after the procedure.
But you don't even have to because it's not even, it's never going to happen.
Right.
I've seen 2 flaps move in 17 years after the first day. And one was a close friend of mine who was lifting a bush, and the roots gave out, and he smashed the whole thing into his eyeball. So we met here on a Sunday morning, and I had to put that flap back in place, and he was fine. And another was an electrician that got whipped with a wire in a weird way.
So something extreme has to happen.
I mean, I have MMA fighters, boxers, policemen, firemen that all, get LASIK.
And
NASA astronauts, naval aviators. LASIK is a very safe and strong and thing to do.
Right. Okay. Good. So I don't have any more questions right now, but I think it would be good to come back and talk again about this and some of the other topics and procedures that we do.
Absolutely. So we're excited to start a video blog like this because it helps our patients to see and hopefully even ask questions and that we can answer in this setting. And I thank you for putting it together.
Okay. Thank you.